I'm Karen, and you're watching Catching Up with Karen Mom Talk. Today's episode, we're going to be covering natural birth or drug-free births. In your birth plan, one of the things you have to go over are whether you want a medicated or a drug-free labor. You want to make sure you speak to your doctor to see what pain management your hospital offers, and also talk to your insurance to see what alternative medicines they cover, or you might have to pay out of pocket. Some tend to be a little pricier than others. So I want to go over drug-free labors. I had an epidural, so I didn't go through a natural birth. I'm hoping maybe for the next one I do get the chance to try. And the reason I'm saying to try is because your birth plan can change at any moment, any minute. Drug-free approaches or complementary alternative medicine, CAM. The reason it's called complementary is because it can be used in addition to your medical or drug-induced pain management. What are the tips into going drug-free? You want to make sure you are in good physical condition, that you exercise gently and regularly throughout your pregnancy, you avoid cigarettes and alcohol, and you have a healthy, balanced diet. Why is this? You want to make sure you avoid as many complications as possible, because if a complication does arise, you might need to be medicated. All drug-free approaches can be used in addition to other birthing techniques. So you can use all of the unmedicated techniques together, or you can use them in addition to the medicine that you are given. You always want to speak to your healthcare provider about your birthing plan so that they can help you by recommending a childbirth educator or another professional who can help you determine if any of these options are right for you. So if you are having complications already before your delivery, things like preeclampsia, low blood pressure, they might have to talk to you about a medicated birth over an unmedicated birth just because of the risks. What are the unmedicated techniques? So first you have Lamaze, the Bradley method, hypnobirthing, acupuncture, acupressure, and TENS, aromatherapy, and herbal medicines. So let's go ahead and talk about what Lamaze is. But it includes relaxation and breathing exercises that can help reduce your perception of pain. So I don't know if you've seen like movies where they're like, breathe. So it's like a certain breathing technique and exercises to help you breathe through the pain. It also teaches you to use distraction or massage from a supportive coach. And this can be your doula, your midwife, or even your significant other. So let's talk about the Bradley method. The Bradley method includes another person as a birth coach. More often than not, it's your significant other. But again, I also recommend a doula or a midwife. The Bradley method encourages medication-free labor until it is absolutely necessary. So it's not like anti-medication all the way. It's if it happens and you can't handle it, or your body can't handle it, or there are complications, it's okay to get medication. It focuses on nutrition, exercise, relaxation, and breathing techniques. You're prepping during your pregnancy with proper nutrition and exercise, and you're practicing relaxation and breathing techniques for during your labor. I don't know if that's grammatically correct. Now, hypnobirthing. I hear about this a lot. It's a method that uses self-hypnosis and relaxation techniques to help a woman feel physically, mentally, and spiritually prepared, and reduces her awareness of fear, anxiety, and pain during childbirth. Different programs differ. You have some that use music, some that use visualization, some that just positive thinking and words to relax the body and to control your sensations during labor. It can be you laying down through labor, everything quiet, lights are dimmed, and you have music playing or blasting. Or it can be you listening to an audio tape that tells you you are on a beach. Your feet are in the warm sand. The water comes and tickles your toes for relaxation. And positive thinking. So you're gonna have someone there with you, hopefully, and they're gonna tell you, you got this, you're a queen, you're gonna push through this, literally, and you want to make sure you're relaxed. Now let's talk about acupuncture. This is the one thing I was really looking into and researching during my pregnancy. I wanted the epidural block, I wanted the drip, I was like, throw in morphine if you can. I was like, and I want acupuncture. I didn't end up getting it. It was like, I want it, but I'm kind of scared to try it kind of thing. So acupuncture may relieve labor pain. It involves the insertion of fine needles into different parts of the body to correct the imbalance of energy in the body. They did run a study on this. The study involved 13 different trials that reported on over 1,900 women. They found that acupuncture and acupressure can help with pain relief and reduces the use of analgesic drugs. Now let's talk about reflexology or acupressure. Reflexology is an ancient, mild, non-invasive technique. It's widely used as one of the non-pharmacological methods for pain relief. It's based on a system of zones and reflex areas on the feet and your palms that reflect an image of your entire body, including your muscles, your nerves, your glands, and bone, in exactly the same order and position as it is in the body. If you've ever gone to a library and seen reflexology books and it's like a hand and it shows you like maybe your feet are right here, your brain. Now let's talk about TENS. TENS, or transcutaneous electrical nerve stimulation. So what is this? So many big words. Are you sure this isn't medicated? It's not. It involves the use of low voltage electronic currents to treat pain. The electric currents block the pain receptors from being sent from the nerves to the brain. How do they do that? So this technique during labor, it involves a little handheld device. They should teach you how to do it. Either an acupuncturist or your doctor will adjust the settings on it. That way you don't hurt yourself. And they'll show you how to use it. Days before your pregnancy, you can also use it for like sciatica and other like issues you have with pain during your pregnancy. So it's a little handheld device that is given to the patient during labor or before labor, and you go ahead and you place it over nerves in your lower back. It has no known side effects for the mother or the baby. Many women find it helpful either alone or in combination with other methods of pain relief, which is what I was saying. These are all complementary, so they can all be used together or they can be used with the medicated pain relief. Now, aromatherapy, my favorite. Aromatherapy draws on the healing power of plants with the use of essential oils to enhance physical and mental well-being. Why does aromatherapy sound familiar? So, aromatherapy is incense. It's diffusers. It's even those little wax melters. How do you use it? Aromatherapy, the oils can be massaged into the skin. You can have a little roll on. You can rub it onto your temples. You can rub it like on your neck, on your wrists. That way you can smell it. And you can massage it into the body. That's what the little roll-on does. If you don't have a roll-on, you go ahead and just put some on your finger, and then you'll massage your temples, massage the backs of your necks, massage your wrists. You can use it in a bath. You can inhale it using, again, steamed infusion or diffusers, or a burner, which is the wax burner. What are the common plants that are used for this? It's Roman chamomile, clary sage, frankincense, lavender, or mandarin essential oils. So we talked about the techniques. We talked about what classes you should be taking, what things you should be researching. But let's talk about other things that help with your labor. You want to make sure you're reducing your anxiety. You can do this by listening to music. It can help keep your mind off the pain. Reducing your anxiety by knowing what to expect. So hopefully by watching this video and the previous video, you know what to expect. And having constant, close support from your partner. It doesn't have to be your significant other. It doesn't have to be the baby's dad. It can be anybody that's in your room to give you constant support. It does help if it's someone you know. So make sure you have that in your birth plan, who you want in the room with you. Other things that can help are walking. So if you are not taking the epidural, you can go ahead and take laps around the hospital. Laps help, taking laps help A, move your labor faster, and B, distract you from the pain. Peeing often also helps your labor go by faster. Massages, again with acupressure. That's what a massage pretty much is. It'll help relax you and take your mind off of the pain a little bit, take the edge off. Taking a warm bath or shower can help with the cramping. It is, after all, cramping that you're experiencing. So if you're on your period, what do? You take a shower. Oh, I always take a hot shower, and even have like those disposable heating pads. I'm a wimp when it comes to period pain. Well, I have really bad period cramps, let's just say that. And again, like I said, the disposable heating pads, hot or cold packs. Your hospital should offer these. They'll either like give you ice or a heating pack. I did get a heating pack. It was nice. And shifting positions. There are so many positions you can that you can birth in. Because I had the epidural, all I could do was lay down and have my knees outwards like that. And if you don't have the epidural, you can really move around, find a position that works for you. You have kind of like a side lying with with your legs open. It kind of looks like a clamp. You also can do hands on your knees. That's the one position I felt like was natural for my body. It helped move things along. I couldn't do it though. I wasn't allowed to because I had my epidural and they didn't want me hurting myself. What are the positive things moms say about drug-free natural births? It's empowering. It's letting your body do what it needs to do. It helps you feel in control, and the pain is temporary. They would definitely do it again. They loved it, and they feel like they labored quicker. However, I have also heard horror stories. These horror stories happen with moms who felt like everything happened too fast and they tore and it was painful and they would never do it again, and they're terrified to have another baby. Their horror stories make them feel like they don't want to have another kid, they don't want to go through labor again because of that scarring experience. If you feel that your labor is going to go down that path, think about a medicated birth. If you are terrified of the pain, you don't need to cause yourself any more anxiety. You can think about medicated birth. There's nothing wrong with using what is offered. Your doctors, your anesthesiologists, your nurses are doing their best to make sure that you labor safely, you deliver safely, and that at the end of the day, you and your baby are healthy. They'll try not to do or offer anything that is harmful to you or your baby, which is why it's important for you to do your own research. That way you don't feel like you're being pressured to do something you're not comfortable with.